Greetings. I'm Ed Baker, and it's a joy to be with you here talking with my great friend and colleague, Dr. John Wiesman, about the practice of leadership, particularly during the COVID pandemic, when he was on the front lines providing leadership in the state of Washington, where he was the Secretary of Health. Prior to that, John served as a local health director also in the state of Washington. He's been a national leader, serving also as president of the Association of State and Territorial Health Officials. That's the national organization of people that do the job that John did in Washington State. And also he served as president of the local health directors national association called NACCHO, the National Association of City and County Health Officials. He is now at the University of North Carolina, where he and I both teach in a Doctor of Public Health program, helping those in that program become better leaders in the field of health. So our focus today is going to be on practicing public health, particularly during the COVID pandemic. The audience for these conversations really are our students, first and foremost, of the type that John and I work with. He now directs that Doctor of Public Health program at UNC. Also, the public health practitioner group are made aware of these interviews, and they have access to them. So through the Journal of Public Health Management and Practice, which sponsors a number of things, these interviews included. These will be posted on the JPHMP Direct website on YouTube, and people will have access to it more broadly. So John, greetings, and thank you for doing this with me today.
Thanks, Ed. It's great to see you and be with you again today.
Well, John, thank you. Let's start with you, first of all. Your formative influences and those factors that really laid the foundation for your practice of public health leadership. Could you tell us about that, please?
Yeah, the things that laid, I think, my foundation for practice, was a Time magazine article that talked about disease detectives. It was my first awareness of public health, and it's really what turned me onto the field of epidemiology. And that was a July 4th, 1983 article in Time magazine right after I graduated from college. Nobody had talked to me about public health before that. The other thing was growing up in a small Midwestern town in Wisconsin, where I really felt like an outsider, something other. And I befriended those folks who didn't really fit in. And it was my first sort of understanding of disparities. And, today I would understand that better in terms of equity. And as an adult, learning that I'm a gay man was my feeling of other. And so that inspired me, I think, to want to go into public service.
John, that's such an incredible story. All of us I know want to hear more about you and your history, but let's jump directly into the role that you've served in the state of Washington, as I've already mentioned, leading that state's response to the COVID pandemic. Obviously, the greatest public health issue for many people of our time. In some of the articles we've written, there are a number of phases of leadership. So I'd like to focus first of all on something that I know you were faced with, and that was the issue of making decisions, making wise decisions in the face of uncertainty and limited information. Tell us about that and any specific examples of how you addressed that challenge, what you did, what it was like for you to make wise decisions.
Sure, thanks. Of course, I think one of the big challenges was we had a new disease that we didn't really necessarily know how it truly was transmitted, what kind of exposures were necessary, how long. And so in this absence of full understanding of data of this new virus, we had to go on what we basically knew. And so basically we would look at the data we had, consult our experts, and then make the best sort of policy decisions that we could. And that started right out the gate from the first case. We had to figure out in terms of contact tracing, like who was going to be a contact. Was it the people in the restaurant where the first known patient at the time was? If so, is it the whole restaurant? So those were really important critical decisions that had to be made, and we had to act cautiously in moving forward and understanding that we were going to be developing new knowledge every day, and we're going to have to be open to changing our ways as we learned more.
So it sounds like as a leader, you had to provide your staff, the folks in the department itself, it's a large department, a lot of people, with the philosophy that you just articulated, which is we have to make wise decisions and we can't wait for all the information to come in. You know, some people were kind of holding back early on. You know, what does CDC think? What should I do, et cetera. How did you almost position yourself in your department to do what is really courageous, to make those decisions, even if all the information wasn't in? What was that like? Talk us about what you did, how it felt, that sort of thing.
It was really, in some ways, like what we do in public health at other times when we have new things, just the spotlight was on us. And it was really about taking the knowledge that we had, the expertise of the folks around us, and consulting with folks. CDC was on the ground with us within 12 hours of us knowing about our first case. And it was about bringing the experts together and recognizing that when certain decisions had to be made, I mean, I made some of those decisions. You know, do you hospitalize the first patient or not? And we didn't know who was going to pay for it, and the patient really wasn't ill enough to be in the hospital. But we said, my gosh, this is the first case. We have to be really cautious. And I said, we're going to put him in the hospital. I don't know who's going to pay for it, but I'm going to pay for it somehow if nobody else will. So it was about sort of stepping up to the plate and the challenges that were there, and making what seemed like reasonable decisions at the time.
Well, I'm really impressed just as you talk about the specifics, because this was back around January of last year. You all published an article in New England Journal of Medicine, which many of us read about that first case. It really did start the ball rolling. But let's talk then about the months that followed, the months and months and months that followed. And you then had this long-term challenge, which is about really managing energy in a general way. And people talk about, and I'm sure you know what I'm talking about, this issue of COVID fatigue. It comes and goes. People were working very long hours under very difficult circumstances, day after day, week after week, month after month. This affected you. It affected people that reported to you, people within your agency. Talk to us a little bit about that phenomena, how you experienced it, how you dealt with it as best you can. There's no simple answers here. How did you manage energy and see that as a real strategic imperative for you in your role as director of the health department?
Well, you're right, Ed. This was a real challenge. And early on, it was a bit easier. I ended up staying, for example, in a hotel near where we were doing our incident command so that I could avoid the travel back and forth from home so I could just really focus on my work. It came to a point where I asked, you know, we had a personal assistant who helped get me from one place to another and who was really focused on just taking care of me, which as a public servant, I must say, felt a bit odd to have that kind of care and feeding, someone who literally was bringing me all my food so that I could just focus on my work. And we even got to a point where we had hired a driver who literally was available 24/7 to take me wherever I needed to be. So that helped early on in the response, but it ended up becoming a real problem down the road. I had kind of lost any of my daily routine. And truthfully, I hadn't been exercising well before COVID. And so I did not have a good physical exercise routine. But I kind of lost my way in there. Literally, I was working, you know, way more hours than anyone should. And so were my colleagues. I was having trouble, Ed. I could easily fall asleep at night, but I would wake up at 2 or 3 in the morning in a cold sweat about the data systems that weren't working that day, or what was the next community mitigation measure we were going to put in place as cases, continued to rise. And I learned, and one of the things I shared with my staff, because they were going through these things too, is I sought out my healthcare provider on one weekend and said, "Look, I am lost. I'm highly anxious. I can't think, clearly. I can't lead." And met with a social worker via telemedicine at 10 o'clock at night, who gave me sort of tips on what to do. And one of the things we talked about is how I kind of lost myself in this. I lost the day-to-day routine. And everything was about work, everything was about COVID. So we built back into my routine some of the day-to-day things that I wasn't doing. And managing my awakeness by, instead of getting up and going to my computer and doing more work, which I will say at 3 in the morning, I found my colleagues also on the computer answering their emails, which was both sort of, okay, we're all in this together, but this is also not healthy. And I learned that what I needed to do was get up, read a magazine, not work, and quiet my mind so that I could fall back to sleep. And I shared that with my staff in a town hall meeting, because to me it was important that staff understand that leaders too struggle with these things. We're not, these superhuman beings that these things don't affect, and to model for them that it's okay to use your healthcare plan. And I think that was really helpful. I got a lot of staff who were really appreciative of my sharing that.
Well, I find it really extraordinary that you're sharing it now with us. Because, as you say, people have this image, oh, you're the director, you're kind of up there, in some way, and you don't have all these issues. But for you to be really concrete, as you just were, what was that 3 a.m. experience like? And to have the courage to share it with your staff. Often that doesn't happen, as you well know. It's really a manifestation of your leadership. So kudos to you on that.
Well, thanks. The other thing I learned through this is I had to model taking some time off. And that, yes, this was intense. And yes, I'm the Secretary of Health, essentially on call 24/7, but you can't do that months on end. And so I literally, built in like a weekend where I transferred my duties to someone else. The funny thing is, we had a federal issue going on with resources at the time. And somebody at the federal government said, "Oh, well, it can't be that bad if the Secretary of Health is off for the weekend." And it was like this total not appreciating that we are burning ourselves out, and we're no good to anybody when we can't think clearly, make good decisions. So it does come with this interesting reaction from some folks.
I'm glad you held the line in the face of that sort of incoming message. We won't go there on this recorded conversation, but maybe you and I could talk about that sort of dynamic in a slightly different format. Well, I want to close this out. I would love to keep talking to you about this for a very, very long time. And I know our students are looking forward to doing so with you when we have our class session in August. And we're going to pick up on this interview. But let's close out with things, and you've already touched on this very, very beautifully, things that you learned about yourself as a leader, the practice of leadership here, from this experience that might carry forward, that might be lessons learned that are applicable to others who do this incredibly challenging job of being a state health director, of being at the high level in the public health system. What did you learn about yourself and take away from this experience that can be shared with others? John?
Well, I think it goes back to not losing myself in the crisis, and to be able to accept help. It's always been awkward for me when somebody offers to, bring me a meal or something like that. But to actually understand that it is helpful and it actually helps them because they see me needing something and they want to help and assist. So that ability to accept help.
Wow, that's a big deal. Thank you so much. Any final thoughts or closing comments or points or anything like that? We've really talked about things at a pretty high level here. You've given us some wonderful examples of what it was like for you going through this in a leadership role. Any final thoughts you'd like to share with our students or anybody else that might listen to this interview, John?
Sure, responding to something like this is a team effort. And you have got to be willing to bring the whole team with you. You have to be willing to reach out to people who you wouldn't normally necessarily reach out to for help. And I think I found that really challenging by my staff who didn't necessarily want to reach out to folks for additional assistance because for whatever reason, they felt like they didn't have the time. I was going to take longer to bring somebody up to speed. But what I learned in the end is that doesn't do any of us any good. And in some ways, as a leader, I wish on a few cases I had acted more quickly to say, no, we're going to bring in this help.
That's a fantastic closing thought and really a source of wisdom. John, thank you for this time together. It's been extraordinary. Thank you for sharing with us so much of what your experience has been. And I know our students in the public health world in general will really appreciate your sharing your thoughts with us today. So thank you very much.
Great, thank you.
This feature was brought to you by DrPH MP Direct, the companion site of the Journal of Public Health Management and Practice. For more resources on leadership, visit the Management Moment Leadership Library, a compilation of more than 15 years of articles from Dr. Ed Baker's popular JPHMP column of the same name. Designed as a one-stop shop resource for students in public health graduate schools, public health agency staff, and individual professionals engaged in coaching and mentoring activity, these articles and leader interviews put concepts into practice. Learn more at jphmpdirect.com.